Hello, everyone. Good afternoon, good evening, good morning. Great to have you all with us. We went ahead and opened up this session, and we're just giving it a moment for a few other people to join. And while we're waiting a few minutes, we will go ahead and have you all do this pre-session poll like we always do. There's just one question, so if you could answer that, that would be great. And also a reminder that you need to select your language of interpretation at the bottom, either English or French. So we want to make sure that you're hearing the right language. So please do that. And at the same time, if you could just introduce yourself in chat. And you can see the instructions in chat for selecting your language. Please go ahead and just introduce yourself. Let us know if there's anyone in the room with you, or if you're there by yourself. That's okay too. So if you're just joining, there's a poll that we would like you to take, just one question. And I want to say thank you to everyone for sending in the pre-work that we asked you to do, filling in the implementation matrix. Appreciate that. And we'll be talking about those a little bit later. All right. I think we can get started. So as if you're just joining, make sure that you choose the language that you want to hear in today, English or French, at the bottom of your Zoom screen. And welcome to the April session for the ICCP ECHO. Please introduce yourself in chat as well. Take the poll. As usual, we're happy to have everyone here today. We're going to be talking about kind of the nuts and bolts, how to implement a national cancer control plan, in particular using an implementation plan or matrix. And we know those can take lots of different forms. They can be in a cancer plan, they can be separate. So we are happy today to be joined by Yannick Romero from UICC. I know many of you know him well. So Yannick, we're glad that you're here with us. We will also be hearing from Zimbabwe in particular, and sharing their experience with implementing their national cancer control plan and using an implementation plan. So we have Dr. Makova to share with us as well today. And then there'll be time for all of you to just reflect on the implementation matrix, the plan that you filled in using two of your priorities. And thank you so much. Everyone submitted it. And so we really appreciate that. And we want to hear sort of your experiences with doing that. So I will get us started, ask you, Yannick, to go ahead and begin your presentation.
Thanks, Leslie. Hello, everyone. I'm really pleased today to make a presentation about implementation and priorities and how to set priorities. I will share my screen now. Let me know if you can see it in presentation mode. Just a thumbs up would be.
Yes.
Yeah, cool. Thanks a lot. Yeah, before deep diving into what are the key success factors for implementation and how to implement a plan, I'd like to show you a few findings that we obtained from the global review that we just published 3 months ago, but we performed the global review of NCCPs over 2023 and 2024. And I wanted to show you those numbers to give you kind of information about what's done globally by cancer planners and what we can find in NCCPs. And these are some results about those NCCPs and how they address governance and implementation according to the region where they were developed, and also the income setting, income level of the country. There are disparities, as we can see, between the regions, for instance. So are those countries are addressing governance and implementation as a really broad domain of governance and implementation. So that included how the plans were linked to a cancer NCD policy, so really linking to the governance structure of the country. Which stakeholders were involved in the plan implementation? If there was promotion or dissemination of the plan among the different key stakeholders, who was responsible for the plan implementation, and specifically if there was an implementation plan or matrix that was included in that. So this was really how we scored and we gave an index to that broader governance and implementation domain for the NCCP analysis that we've done. When we look at the income level, there is kind of a balance between the countries, but still we can see that there are some disparities between countries. So that gives you kind of a sense of what's happening in terms of implementation globally. Disparities between the regions, and some kind of a balance between countries in terms of income setting. And when we looked at the monitoring, evaluation, and also of the implementation, you can see on the left side, we looked at three different aspects of the plans. First is there any implementation, monitoring and evaluation of the implementation? Clearly, 20% of the NCCP showed no, there is nothing about implementation. Then 60%, so the majority of the cancer plans, had a strategy or separate M&E or implementation plan that was referenced. And 21% of the cancer plan had a detailed evaluation mechanism and responsibilities that were detailed in those plans. When we look at the two answers that we had in light orange and darker orange here on the right side, when you look at the implementation, so the monitoring of and evaluation of the implementation, according to the region, you can see those disparities and how they are distributed according to those regions. Sometimes it's really balanced. Sometimes you have, for instance, in the Emerald region, you have no cancer plans with detailed mechanisms for and responsibilities that were detailed. You look at the Euro region, it's the majority. So majority of the plans have strategies or separate. So we can do a whole analysis on that. But I wanted to show you how the countries were addressing the monitoring and evaluation of the implementation. Same for when we looked at the criteria for which was the income level, and then you could see that there are some disparities between the income setting. And most important also is that who is involved in the development, but also in the implementation of the plan. On the top of that bar graph, these are the distribution of the different stakeholders that are involved in the development of the plan, which is not really surprising. Ministry of Health is present, so is involved in the development of the plan. 84% of the NCCPs. You can find other stakeholders, civil society organization, this is the second categories with 57%. And then you have clinicians, cancer institute, academic institutions that are roughly, really roughly the same amount and percentage that are involved in the NCCPs. When we look at the implementation and the involvement of those stakeholders, again, 72% are government ministries that are involved in the implementation. When you look at civil society, a bit less compared to the development, Cancer Institute, clinicians, and so on. There are different categories that we looked at also is the people living with cancer. How they were involved in both development and implementation of their plans. And we could see that they are really not involved at all, so less than 1/5 of the cancer plan had people living with cancer involved in the NCCP development or plans. So in a nutshell, just to give you kind of a glimpse of what happens globally with implementation and monitoring and evaluation, which are really aspects that are crucial and essential for the NCCP implementation here. I think it's really important to keep in mind that there are disparities among regions and in income level, but also in the categories of the different individuals and organizations that are involved in the development and implementation. So let's deep dive now in what is needed from the planning phase to the implementation of a plan. First, you've all went through that process, which is identifying cancer control as a key health priority nationally. So you've done all of that, the pre-planning phase and so on. What are the foundation of a plan, the leadership, political will, and so on. You went through appointing a focal point, and so on and so on. So you all decided to start that NCCP. Then you went through the planning phase, so really gathering the evidence, maybe performing a SWOT analysis to look at the current status of the cancer burden, the risk factor burden, and so on. And you have established leadership and roles for the development, well, the planning phase of the NCCP, having identified the different stakeholders and also costing the plan. Once you have developed that plan, you didn't left it on the shelf, and you started to do the implementation of the plan by choosing priorities. So this is what you have to do to keep the partners that were involved between the planning and pre-planning phase and the implementation, defining a plan of action according to your priorities, and so on and so on. A lot of things that you have done, and specifically developing a M&E framework and setting indicators for that. And then you can start to implement your plan. So that's I would say the best example that we can make, but we all know that it's not always the case. And it's really according to what we want to do is how do we want to implement those plans? Why do we need implementation plans within the NCCP? First, where they are. They can be part of a published NCCP. So we saw that in the analysis that we've done. It can be a separate document, okay? Also as an implementation matrix or whatever. And you can have entire plans where you can set priorities and you can focus specifically on a type of cancer. You can specifically focus on different priorities that you might have in your plan. But these are the different types of NCCP implementation plans that you have. The question, always the question, I think it's really a challenging question, is do we need to have an implementation plan that addresses all the aspects of the NCCP that we developed, or just few selected priorities? And here with that slide, we want to show you what are the benefits of addressing all the aspects of the NCCP, or what are the benefits of the selected priorities, and with also the challenges. With the benefits of addressing all the aspects of the NCCP, you have a comprehensive roadmap. So you can go from A to B and you follow that plan that you have developed and you implement it. So really comprehensive. It allows you to better cost and allocate the resources of the plan that you developed. The challenge is that it's a lot. It's a lot when you want to implement it. Could be overwhelming for the teams and for the country to implement it, because there's a lot of priorities and you have to deal with different challenges, which are financial, human resources, and so on. The thing is that when you also address it as a whole, the context can change and the situation can change, which means that you might need to update also your implementation plan. And this is the third point here. It provides less flexibility when you only when you address all the aspects of the NCCP. What are the benefits of the specific priorities that you set in your NCCP? So it's more flexible. We just saw that is that you can focus on one specific priority of your plan and adapt to the context. You can have partners that are more engaged and they are focusing on a specific task or a specific priority, which means that you will be more efficient. And it's also easier to show the progress on one specific priority. The challenges are you may not provide the big picture that you were planning from the beginning. And you would also just show one priority moving at once and not in parallel with others. And it also requires a lot of management and partner engagement for specific priorities that you've selected. So as you could see, there are benefits, advantages, and challenges for both of that, and you have to adapt according to your national context. So if you focus your focus implementation plan as the highest chance of success, so NCC if we start on the top of that cycle here, well, you have NCCP, you update the data, we have new resources available with services. Then you select the priorities. Okay, you create your implementation plan with the different components that we saw before, the timelines, the roles of the different partners, or what are the responsibilities, the resources that are allocated to every interventions and measures, and also how you make them progress. Then you evaluate, you monitor, and you evaluate all the progress, but also the challenges, and you adjust it to you adjust your implementation strategies according to the changes in your national context. So, and then you restart. This is a new iteration, and so on and so on. This is kind of the framework that could be used to develop an implementation plan. But also, you cannot do everything in the plan all at once. So you have to set priorities for the plans, and it's something that it's always difficult to make, but it has to be evidence-based. Focus. So on what you are able to do, you have to be really strategic about all the resources that you have, human and financial resources. Who are the partners that are with you, that were here during the development phase, but how you can engage also others. And you have to be flexible enough to adapt to all the changes. For instance, if you have elections, or if you have a disruption, a conflict, or a pandemic, for instance. So how do you adapt your implementation plan according to those changes? And adapt the priorities, so setting those priorities. This is, you have to really address and how to you identify the criteria for the priorities. So these are the questions that you have to ask yourself when you want to set your priorities. First, is it a significant area of need in your country? Let's talk about, okay, how the cancer burden is or cervical cancer burden is in the country, for instance. That's a question that should have been asked at the beginning, before starting a priority on cervical cancer, on HPV vaccination, or cervical cancer screening. Do you think that there's a good chance for success of that priority? So according to different criteria, which are, as I said, the infrastructure, the human resources, of workforce, financial resources. And that's linked to the third point here. How do you obtain those resources to implement that priority? Let's keep cervical cancer as an example. Do you have all the infrastructure to bring HPV vaccination to the right place? Do you have the health workforce to support that, and so on and so on? Also, one important aspect is, do you have other partners that you need to involve in that priority, which means that do you have them already in your network, or do you need to recruit new ones? And that needs a lot of work to do and to maintain as a relationship. And also, what is the added value for your country's cancer efforts if you want to address rare cancer which is not in line with the health strategy or the cancer strategy of your country. So keep in mind those criteria to identify the priorities and those questions that you should ask yourself about the priorities setting of your NCCP. So this is just a diagram where you can there are many different diagrams outside, and this is one of the examples that you can take how to set priorities. So previously we've seen that you use those criteria. Once you have those criteria and you say, okay, let's go for cervical cancer, you have identified those priorities from the NCCP. You identified also all the partners who work in the priority areas. That could be all of the different stakeholders that are present around the table, but also within your network, and not only nationally, but also internationally. So once you've done that, you can work with your partners to develop the implementation plans by allocating tasks that are well informed, and the responsibility for those tasks. Are there any other partners to involve in the implementation? The timelines, so really having timelines well set and that are realistic. What are the resources that you have but you might need to implement correctly your plan? And finally, what are the measures that you want to identify to track progress and to monitor and also evaluate, and being able to be flexible enough to adapt your implementation? And then you take action. So you can set working groups that are focused on one specific priority or part of the priority. You need to coordinate across the partners and the priorities. You have to ensure that the work is evidence-based. You need data from the beginning. It's one of the criteria also to set the priorities. Be aware of the context, the political will, and so on, and then you adjust, and you can track and communicate your progress. So this is one of the examples that you can find as a diagram to follow for the implementation of your plan. This is an example of priority action plan, implementation plan. There are so many outside, and you've seen that some were shared with you also. But it has to be really an active tool that you use, and you have to use. It's not just a piece of paper that you start at the beginning and then you let on your desk. You have to work with it. You have to work on the existing programs, for instance, for a vaccination. I'm talking about vaccination, but other different programs that exist in your country. It helps you to track all the progress that you've made with measurable outcomes, and that links to the objectives. You might have developed smart objectives from the beginning, and you have to anticipate. So you have to mitigate the risk and the challenges that you could face in the future, or when developing when you're implementing your plan. This is also one of the examples that you can take, but you have to use it. Here it's also one of the implementation plan that we can find in NCCPs, for instance, where you have a goal and objective, and then you have all the interventions and sub-interventions. I'm sure that you've seen that before, that you've developed yourself, but these are the implementation matrix. This is an implementation matrix that can talk to the right people, I would say, in the Ministry of Health, but also in the Ministry of Finance, and so on, and all the responsible individuals and organizations that are involved in the implementation and development and implementation of the plan. You can find the target, which is what you'd like to see at the end of the planning phase and the implementation phase. The time frame, we said timelines are really key, so you have to be sure that its timeliness is it appears in your implementation plan. The cost, clearly, we know that when NCCP is well costed and the implementation plan is well costed, it has better chances to be successful, or at least to be implemented. And also the responsibilities. Who are the key responsible for those interventions? This is another example that we could see. For instance, this is the Malaysian NCCP that was running since 2021 until 2025. And it's a bit different, but as you can see, you can find different components that are that could be replicated from another NCCP, and really commonalities, objectives. Here they called it strategic actions. That could be interventions. What are the indicators for that? What are the target, the date, the timeline, and who are responsible for that specific intervention? Another one here is for the Senegal NCCP, and same here. You have the interventions, you have the measures, you could find the baseline also. What are the deliverables? What is the timeline for that intervention, and also who is responsible? So with that, you have few examples showing you that an implementation matrix will help you to better deliver your plan. And that's it. Thank you very much.
Thank you so much, Yannick. That was excellent. Thank you. So I just put into the chat that if you have questions for Yannick, if you could please put them in. And I see Dr. Siraj, you have put one in. I want to go ahead and have Dr. Makova from Zimbabwe give his quick presentation, and then we'll take Q&A all around for both Yannick and Dr. Makova.
Thank you very much. Let me see if I can share from my end.
We are prepared to share your slides if you would like us to. Would you like us to do that?
That will be great. Thank you.
Okay, we'll get those up right now. And I'll just mention that you might see a little bit of delay when we advance the slides. So just give us a second and you'll be able to see them.
That's excellent. Thank you. That should be the first one. Thank you very much for this opportunity. I'll try to stick to time. I have 10 minutes to present, and I'll be taking you through the implementation strategy for Zimbabwe, focusing on a number of thematic areas. And then I think the last two slides will then look at the priorities that we selected for this presentation. I think we can go to the first slide on service delivery. So the first thematic area from our NCCP implementation framework is on service delivery, which speaks to improving cancer services access at all levels of our healthcare system to ensure from the primary care level, we have trained health professionals with oncology literacy who are able to refer patients in need of cancer services to higher levels of care. And most of these activities for this thematic area are implemented by the Ministry of Health and Childcare, abbreviated MOHCC, and partners. Next slide, please. The next slide is looking at our healthcare workforce. This is one of the integral components of the implementation of cancer control plans in the various countries, where the actual activities from prevention, early detection, diagnosis, and treatment require an adequately trained healthcare workforce who are skilled in their various areas of training. And in Zimbabwe, we aspire to improve the training of cancer cadres with the assistance of the Ministry of Health and also the Ministry of Higher Education and Training, which oversees the training of both medical and nursing practitioners, and with support of our local government, or our national government rather, which supports training through manpower development initiatives. The next thematic area is on infrastructure, where we seek to upgrade existing infrastructure as to international WHO and IAEA approved standards, to ensure that we have working equipment for diagnosis, for screening of patients, as well as for treatment, with aspirational goals of having new centers. I think that's the next slide on infrastructure after the
Dr. Kudzai, I wanted to ask Felicia and Clay if we can put the slides in presentation mode so we can see them a little bit better. Right now, for us, it's just it's not in presentation. Give us 1 second.
That's okay. That's okay.
Yeah. There we go. Thank you.
Thank you very much. I'm sure it's now reader friendly. So I was speaking to infrastructure and equipment, where the in our implementation framework, we aspire to upgrade existing infrastructure to international WHO and IAEA approved standards, as well as setting up of new cancer facilities, particularly at the provincial level. And some of the implementing partners would be the Ministry of Finance, who would help us to pay for these developments. The next slide is on monitoring and evaluation, which I hope will be projected now. And I'm glad that Yannick spoke at length on the importance of monitoring and evaluation, particularly to help in the influence and informing policy decisions. When we actually came up with our priorities in our focus group discussion, we're using data from our cancer registry, and we are very impressed with the work that our cancer registry personnel have been doing in collecting cancer data. And this will improve our knowledge on the epidemiology of cancer in Zimbabwe, as well as making appropriate policies that will improve access to cancer care. Then the next slide is on healthcare financing, which we hope will be projected, which the main goal of this thematic area is to ensure increased and sustainable funding for comprehensive cancer care services by 2025. But this program is running up to 2030. And from a previous presentation, we spoke of the sugar tax that has been levied by our Ministry of Finance to help raise funds for cancer care services, particularly to acquire new equipment for diagnosis and for treatment. Now, in the last 5 minutes, I'll move on to the priorities for today's presentation. I think the first one is on HPV vaccination. The last thematic area which I didn't project was on our priority cancers, which include cervical cancer, prostate cancer, breast, and childhood cancers. But because I'm going to focus on cervical cancer, I chose to focus on those two. So our first priority is to improve our HPV vaccination coverage to attain 90% coverage by 2030. Our current coverage is around 65 to 70%. It differs from the different provinces and districts, but it's around 70% from our 2024 data. And the goal or objective from the NCCP that this priority is in support of is in the improvement and strengthening of cancer prevention services. This is a cost-effective public health intervention that will achieve the desired results perhaps in the next generation or so. As one of the challenges in our healthcare system is we are diagnosing cervical cancer at a very advanced stage. The measurable outcome we expect by implementing this priority is to see the number of girls who are fully vaccinated by the age of 15, because this is a program that is targeting girls of school going age between the ages of 10 and 13. The specific activities to achieve this objective includes integrated outreach programs, particularly in districts and areas that are identified to have a low vaccine coverage. The Ministry of Health and Child Care district health teams would be responsible for this initiative. And we have trained staff in the expanded program of immunization who already participate in the immunization programs for other vaccines. They are the staff that actually spearhead this effort, the resources that are required, transport, fuel, and the vaccines. And some of these are supported by partners. And the time frame for completion up to the year 2030, which is the time frame for our NCCP. And how do we evaluate? We have quarterly vaccine coverage data for the district, which is available on our DHIS monitoring system. And our partners that we engage for this initiative for vaccination are the WHO and the Clinton Health Access Initiative, who are very active in a number of our provinces. And the last slide is, in my last minute, is our second implementation priority on the decentralization of cancer services to the provincial level. And this speaks to the first thematic area which we projected on improved service delivery and improving access of cancer services to all levels of our care. And how do we measure this? By the number of provincial hospitals with access to cancer treatment services. We can enhance this implementation priority by the improved and enhanced training of more oncologists, palliative care nurses, which our institutions of higher learning are actively doing. And we do have the training facilities, the universities, the nursing schools, and we have the willpower from our national government to fund manpower development. This is ongoing, and as part of our monitoring and evaluation, the human resources departments have staffing levels that are supposed to be met to ensure that we have adequate cadres for this initiative. Thank you very much. I hope I was able to stick to time.
You did. Thank you so much. We appreciate that. That was excellent. Thank you for sharing what is in your plan, and also the putting those two specific priorities into context for us. So we have time now for questions of both Yannick and Dr. Makova. So I know that Yannick, you probably saw in the chat there were a couple of questions. And Dr. Siraj, I don't know if I'd like to come off mute. And if you're with us still, would you like to ask your question?
Yeah. Thank you, Leslie, giving the opportunity. So now I'm the two presentations are very thought-provoking, and because we are also now currently thinking about developing next 5-year plan after getting inputs from impact review as well as the internal review which we conducted among national colleagues. Now, my question is regarding this the main plan and implementation plan, because when we when we consider implementation plan, whether it is we identified major activity, and for to achieve the major activity there may be series of sub activities. So whether we are prioritizing selected sub activities initially, so that's one thing. And other thing is now if we are going to implement countrywide or national wide, so it may not be possible at the beginning. So we need to prioritize the practical, feasible, more ground support available district first, the locality first, then scaling up. Then third thing is about the availability of funds, because fund now if we develop a plan for 5 years, now at the beginning we are not sure that the what level of funding is available for the 5 years, because now we are thinking of a current level of funding. So there may be additional funding from the national budget. There may be donor support sometimes. So with the availability of funds year by year, our fiscal capacity may change. So whether we when we consider implementation plan, whether it is with little bit dynamic over the years, or implementation plan should be for the if it is a 5 year plan, with the implementation plan also show for the 5 years first, and later it need to be updated regularly. Yeah.
I don't know if well, Suraj, thanks a lot for your question and comment. I think it's really about the context and the constraints on the budget that you have in the country, and how flexible and how you can adapt your implementation plan according to that context. What I understand is that there are constraints, and being able to be flexible enough is a good thing in some settings. This is what we saw in many countries. You have to adapt, you have to be flexible enough, but maybe for the implementation plan, you have to align it with your NCCP and then your implementation matrix. You have to be able to adapt that implementation plan within your NCCP, which is aligned with your objectives. So really being able to show that it's really beneficial for the implementation, and then to mobilize resources according to the change in your context. So I would say that the more flexible, the better is to obtain those. Either you secure those funds, or to readapt, or to just extend those costs to other activities. So flexibility, I think it's really something that we have to keep in mind, but really depends on the constraints that you have in your country, and you know it. You know it better than me. I mean, not only in Sri Lanka, but in other countries, that with all the different changes, either in domestic or international changes, we need to adapt. And the flexibility is something that we have to keep in mind when drafting the implementation plan, which means that maybe a yearly or bi-yearly planning is better for implementation plans. But maybe other country representatives here, individuals, can say something. Maybe I'm wrong. I might be wrong, certainly.
Thank you, Yannick. I think that's really helpful. I think the key is flexibility is important. And I think it goes along with the question that Kolasili from Eswatini put into the chat, which is how I think should priorities be driven? Is it according to the resources you have, or is it according to the gaps that you want to fill? And Kolasili, please feel free to come off mute and ask any other follow-ups to that. Yannick, go ahead. What do you think?
Yeah.
Yeah.
Those questions, guys, you know me. I can speak for hours about it. It's always about the criteria that you set from the beginning when you set your priorities, which is according to the cancer burden in your country. So that could be the risk factor burden, how the infrastructure is set in your country, what is the how your health system is built also. Um, do you think that there will be, as I said, chances for success for that? So do you put the resources in front of the things, the low-hanging fruits that you can have in terms of impact on cancer control? What are the who are the stakeholders that can help you, the partners that can help you to implement? So putting resources for the low-hanging fruits that you know that you would have a better chances of success, I would say yes. But at the same time, you don't want to just give up on the gaps that you have in your country, and maybe there's greater chances to obtain also and mobilize the resources for that specific gap. It really depends on how you set those criteria when you identify the priorities.
Thanks, Yannick. And maybe just to add to that, we talk a lot about as you develop your implementation plan, looking at what resources are out there and leveraging those resources. And I think it's smart to start with a high level of certainty or confidence that you think you can achieve what you're trying to implement first. So, sometimes it's best to start with that low-hanging fruit, and success follows success. So when people see you're actually making a difference, then the expansion can really come from that. So, okay, maybe you start in one city or one region and you do something and then show that you can be successful. And then that's where then you expand and maybe need more resources, but you have then a real strong argument that you're able to show progress. Kolesi, I see you came off mute. You're on mute now. Kolesi, did you want to say something?
Responded very well, and also I think I appreciate your input, Karin, especially when you're referring to the low-hanging fruits. So I think that one is okay, because the main challenge, especially to us, the low middle income countries, I would think of that. We normally, it's easy for us to get support or resources through the cervical cancer, HIV positive women. So then that can tempt one to focus mainly on the cervical cancer, whereas we have other activities that you are expected to accomplish within the 5 years of your strategy. So, but I do appreciate of focusing on the low hanging fruits, and also probably on and then you take advantage, like probably from our previous strategy, we make use of the HIV related cancers, and then we added some of the activities to strengthen our program. So I think I really appreciate that. Thank you. Over.
Thank you. It's a good question. And also, Yannick saying you just really have to be flexible about how, if something that you planned, you're going to come into challenges or roadblocks that you probably didn't even anticipate. It's good to try to anticipate those things before you start or as you're implementing is, what can we expect? What's the reaction of certain people or organizations? Is there a way you can preempt that any challenges or roadblocks. So kind of issues management as you go along. What's happening? Let's be mindful of what's happening during our implementation, and do we need to kind of reset and think we got to do this in a little different way than we anticipated. Which actually leads us to so thank you, Yannick, for your responses to that. We are really thrilled. We got implementation plans from every country team, so we are very grateful for that. And obviously, we don't have time to go through each one, but we are going to put them on the iEcho site, and so you'll be able to see what other countries have put in their implementation plan. But the question is, so we don't have time for that, but we want you to kind of take a look, and maybe you'll get ideas. Oh, I hadn't thought about this, and so you might get ideas from other teams' plans. The question we want to ask now in our few remaining minutes is, how do you plan on using your implementation plan? So is this something that's just going to stay kind of with you on your computer, or hopefully not? How do you plan on sharing this with others, and how are you going to use it? Like maybe in meetings, and how are you going to help it track your progress on the things you said you were going to do? So anybody want to answer how they are planning to use their implementation plan itself? You got to have a plan for your plan.
No, I think I could answer that question. Thank you very much. As we are launching the document, it will be in a booklet format that we can share with the different relevant health personnel, particularly in our districts. Zimbabwe has like 63 district hospitals, about 7 to 8 districts in each of our 10 provinces. And if we send a copy of our implementation of our full NCCP document, it will enable our district medical officers, who are actually the drivers of health programs for the ministry. So all the programs like HIV, TB, and malaria, which are well funded and are very well run, do very well because there is a lot of support and supervision. So one of the ways that we could actually help to ensure that these implementation plans are a success is to support and supervise our staff, particularly at lower levels of care, the districts and the primary care facilities, to ensure that our targets are being met for programs that they are very familiar with. And HPV vaccination is one of them. It's one of the national programs which will hopefully, like I mentioned in my presentation, will turn the tide on cervical cancer because it's a cost-effective program. It's much cheaper to vaccinate than to treat with radiation and surgery. So that's one of the areas that we hope to focus on, particularly for the district level staff and the lower levels of care. Definitely. Thank you.
Excellent. And that sounds like a great plan for your plan. And I think it's, in our experience, what also we've seen is that when people can see the big picture and that is the cancer control plan, when people see that big picture, but then you can break it down into feasible steps, they understand where they're going and why you're choosing and what those priorities actually mean and how it all rolls up into that big picture. So if they feel like, hey, I'm doing something to actually make an impact on cervical cancer by implementing these guidelines in my clinical practice, it becomes a bigger goal, and hopefully they can see their role in achieving that goal. Anyone else want to comment on how they are going to use their plan, their implementation plan?
Anyone from Indonesia or? Dr. Traore, please go ahead.
Alors, je pense que pour
Hi.
le plan de mise en œuvre,
So for the
une fois que le
implementation
plan est
plan,
élaboré
once the
et
plan is
partagé avec
finalized, we're going to
les
share
parties
this plan
prenantes,
with
on
all
sait
the
quelle partie
stakeholders.
prenante
We
sera
know
actif ou acteur
which
de la mise en œuvre de
stakeholders is
quel
going to
type
be an
d'activité.
active part
Alors, pour le
for our
suivi, il y a
activities.
des réunions de coordination,
So we'll
des
share that. For
réunions
the
de
follow-up, we have
présentation, par
coordination
exemple,
activities, we have
de
meetings with all the
l'évaluation des
stakeholders, we
activités
have
mensuelles,
also
trimestrielles et des réunions de
quarter and
coordination
monthly meetings to assess
semestrielles
our
où les
progress. And every
résultats
6 months, we
sont
will meet
présentés. Et en plus,
to
il y aura
present our
toujours
results.
une
And on
évaluation
top of that, we'll have
annuelle
one annual
de la mise en
assessment
œuvre du plan d'action
of our
opérationnel
action
annuel
plan implementation.
et
We'll
à l'issue
assess its
duquel
progress on a
nous
yearly
verrons
basis. And after
les
this
activités qui
meeting,
n'ont
we
pas
will
pu être
reassess
réalisées
the activities
et
that
pour
were
quelles
done
raisons
and
et
that were
essayer
not
de
done. We'll
planifier
see
des
what
activités
went wrong
pour les
for the activities that
années
we
à
couldn't
venir
deliver, and
et
we will
voir les
reschedule
points
these
forts et
activities
les
for the
points
upcoming year.
faibles à
We'll see
renforcer
the drawbacks,
également.
the
Donc, il y
points,
a
the
des
items that we need
indicateurs qui sont
to
définis
reconsider.
et
We
qui
have very
permettront,
well
on va
identified
dire, l'impact
indicators that will
de la
allow
mise en œuvre
us
des
to
objectifs du GRID
assess the
au
impact
niveau
of
de la
our
lutte contre le
activities
cancer.
in terms
Merci.
of cancer control. Thank you very much.
Wonderful. Thank you. That's a great plan to use your plan. So we only have a couple minutes, and I want to quickly ask you all something about next month. So we have scheduled next month, our next ECHO is going to be on May 21st. We also know that is the week after the Cancer Planners Forum, which I think a lot of you are going to. It's also the week of the World Health Assembly meeting. So if you could put in the chat, if you are planning on attending, or let's see, what's a better way? If you can put in the chat, if you will not be able to attend on May 21st. So just a yes or no. I can attend or I can't attend the ECHO itself. We want to understand how many people will be available and maybe do some adjusting to our schedule if a lot of people are going to be gone. So if you could answer that in the chat, thank you. Very good, Mishka, because it wasn't the clearest question. With that, I also want to just really thank our presenters and speakers today. It's such a great subject matter. It really is just like, I think, the most important one, because if you don't implement your plan, it's just a plan sitting on the shelf. So really love that, that we were able to have this discussion and hear very tangible things about how people are implementing their plan. You'll see that the poll has come up regarding your impressions. Will be, we appreciate that. We always use that feedback. And any other announcements, Leslie? I want to make sure I've covered everything.
No, I don't think so. The only thing I would say is, we want to continue the conversation. We probably could talk about this for another hour and have all of you share insights and reflections from the implementation plans. Please go on to iEcho soon after the session. Maybe by tomorrow, we will have posted all of the implementation plans that you shared with us. And I know some of you said you were still working on them. We'll go ahead and post them now, and then when you have a new one, you send it to me, and we'll replace it in iEcho. But I think it's so valuable for everyone to just look at the planning and the partners that you're working with. So please do that. We'll also be asking a question on iEcho for you to respond to. There's a discussion part there. So we want to keep the conversation going, and thank you so much. We'll be using these implementation plans as we move forward. So don't be surprised if we send them back to you and ask you to add another aspect of how you'll be implementing those priorities as we move through the ECHO sessions.
And again, if you haven't answered in the chat whether you'll be able to attend the May ECHO session, yes, you will be able to attend the ECHO session, or no, please let us know. We see a lot of yeses, so that's good, but I don't think we've heard from everyone. And with that, I think we'll close it out again. Thank you, Yannick and Dr. Makova. We really appreciate your time and preparation for today's session.
Thank you so much, everyone. Great
Thanks.
to see you.
Thank
Thank you,
you.
everyone.
Bye.
Bye.
Thanks.
Bye.
Bye-bye.